very happy to be introducing today's HAI lecture series speaker, Dr. Julie Albright. She's visiting us today from Knoxville by way of Phoenix, by way of Vegas, but in Knoxville, she's an associate professor at the University of Tennessee, College of Veterinary Behaviorists. Similar to many of us, her background is actually in psychology, fun fact. So she has a bachelor and a master's degree in psychology from Vanderbilt and UT Knoxville, yes, respectively. And then she can't talk anymore. She then went on to receive her D.V.M. From the University of Tennessee, followed by a residency and a postdoc at Cornell and their vet school there. And she's been board certified as a veterinary behaviorist since 2009, and is a clinician as well as a researcher. So her research interests include behavioral genetics, emotional health, and of particular relevance to our group, the human-animal bond. And she's done a lot of work around understanding and treating anxiety and stereotypic behaviors in horses, dogs, and cats. So I am thrilled that we are getting the opportunity to learn from her today and spend the day with her, some of us like me. And with that, I will turn the floor over to her. Thank you.
Unlike many of you, my model in grad school, when I was in, I did my master's in behavioral ecology, was working on snakes.
Oh,
so
cool.
Yes, I bet nobody else can claim that in this room. But yes, thank you so much for welcoming me. When Emily and I talked about this, some of you probably know my colleague, Dr. Zini Ng. So it was like, he's already presented a lot of the research that I worked with. So let me talk. I bet a lot of people don't really know the medical framework that we kind of approach behavior from. So thinking about how we can break down silos and not just think about working in frameworks, but working together. So that's what this talk is going to be about, is collaborative treatments and diagnostics for companion animal behavior. And I picked this picture from my stock photo subscription because I put in, cat, dog, human. And this is the cute little picture that popped up. And I bet a lot of you in this room are like, oh, I see about 3 disasters about that. So the human animal bond, everybody in this room is, working and thinking about that to some respect. And there's a reason all of us think about behavior. It is the interface, right, for the human animal bond. We keep pets. We, allow pets, force pets into our homes because, they sleep in the bed with us. We get the snuggles with them. We get to go hiking with them and they enjoy that, right? They become the behaviors that they display are why we bond with them. And then for those of us that are practitioners, we know very well that unwanted behaviors are why the bond breaks with them. That's really the heart of the matter, one of the most important reasons. So you may be asking yourself, what in the world is a veterinary behaviorist? Maybe not folks in the room, but maybe on Zoom. Emily already kind of gave you my my whirlwind journey to here. I took some side trips into, grad school. But veterinary behavior, it is an AVMA recognized specialty like dermatology, surgery, ophthalmology. We do have our own specialty recognition and framework. So we all went to vet school, and then we had to have extra experience in general practice or in a rotating internship to make sure we honed those clinical skills, not just related to behavior. And then we did those residency programs. So I happened to take a side trip before vet school to go to grad school, but that is not a requirement at all. Some of us call ourselves veterinary psychiatrists. There's some pros and cons to that and some valid parallels and some problems with those parallels, but nonetheless, our academic journey is very much what a psychiatrist would have done. That said, we have a very medical framework in which we approach behavior problems. So in other words, behavior is a symptom. That's how we look at it. The same way the behavior of limping is a symptom of pain, right? The behavior of scratching is a symptom of itchiness. the behavior of biting, of growling and biting is a symptom of a negative emotional state. So that's the way in which we start to look at things. So we're very much starting with circuitry and kind of tangibles, in other words, like what chemicals can we measure? What neurocircuitry can we think about and discover? And so, it is, again, a very chemical base, neurobiology, neurocircuitry, biochemistry kind of base. That's how we look at, we're very romantic. That's how we think about emotions. They're basically chemical reactions, right? So, if you are a psychiatrist or you are any sort of medical professional, you're often using words like pathological. So we do find ourselves using that. Is this a normal behavior? Is that pathological behavior? But I think most of us really would accept lots of unwanted behaviors, actually normal behaviors. So I do use words like adaptive and maladaptive. Is this an appropriate response in this moment? Even if you, doggy family, don't like it, it is actually normal behavior, but there are times, right, that it's a maladaptive behavior. So for those of you not from a behavioral ecology background, that essentially means, are they living long enough to pass on their genes to the next generation? So that's just the beginning, though. So for us to look at behavior, we are absolutely, again, thinking about the chemical components of the dopamine, the serotonin. Are these all levers we can tweak to change behavior and emotion? We need to know from our psychology friends, our learning theory friends, about emotion or learning, associative learning. So the difference between emotional learning and Pavlovian learning versus operant conditioning, right? That's kind of the meat and potatoes of how we change behavior. Cognition, you got a couple of the best in the biz, actually sitting right here in this room. So what is cognition? Probably way too simplistic is, how is a creature, how does an individual perceive the world? How do they process that information? What do they do with that information? And these two are probably, and I'm pointing if you can't see, to Drs. Bray and McLean, they're probably cringing at that explanation of it. But then when we're getting into our domestic animals, our companion animals, not only are we having to think about how they're interspecies, but or within species, but also because dogs in particular, right? They're such a special, cool species that actually evolved with us. And I don't think little homage to my kitty friends here too, maybe a little more rudimentary than our canine friends, but nonetheless, to be successful pets, and that's probably not a great word, right? But for us to be good pet parents, we need to understand not only that within species, but also that between species cognitive capabilities. Natural history, right? Dogs are just little wolves, right? No, the answer is no. The answer is absolutely not. But is there something we can learn from their evolutionary ancestors? Is that appropriate? So we are absolutely drawing on folks that study, their natural history as well. And then, of course, here come us veterinarians that I kind of cringe. I see it a lot. Is it behavioral or is it medical? It's all like our limbic system and our emotional system is not a separate part of our body. I know what people mean when they say that. I think what they actually mean, is it emotional or stress, or is it kidney disease? But nonetheless, we are all, these are not separate systems really. That is a false dichotomy that we make. So that's maybe where we come in and we can help you, is to be thinking about how can inflammatory states and, pain and things like that inform the rest of these, especially cognition, right? On the individual animal level. And then I have to filter it through a human that is attached, right, to that. And again, you got the best in the biz here, kind of looking at how that human component. So most vet schools now have things like veterinary social workers that help us extract, the best information from our clients. because they are filtering this, right? Even if I was going to doing a house visit, it is still false. I need the information from the client. And really all these arrows should be two-way, right? So like how the human is also affecting the behavior and vice versa. But again, that's the data we use to then come up. They can't hear us.
No, they can.
Okay.
I'm just slightly adjusting what they.
Another way to look at this is, let's think about aggressive behavior. And a framework that I always fall back on is Robert Sapolsky, right? So WWSS, what would Sapolsky say about this? And he has a wonderful book called Behave, where he outlines a really simple but elegant framework about thinking about behaviors kind of in reverse chronology. So what happened a second before you saw that behavior? What happened 10 seconds? What happened hours? What happened weeks? What happened decades? What happened millennia? It's really just a fascinating framework to think about the why, right? Because a lot of us that do work with pet owners, it's like, oh, it's all genetics. Oh, it's just all in the way you raise them. It's all nature or nurture. And of course it's not. So I find this framework to be very helpful when thinking about these things. So I just want to run through a couple of examples related to companion animals real quickly. And of course, our framework and the way veterinary behaviorists might think about it. So, a millisecond before we had, let's say, an aggressive behavior. And that book, by the way, Behave, really is about aggressive behaviors in humans. And by the way, Robert Sapolsky, if you don't know that name, is a world famous neurologist or neuroscientist, primatologist, just a super cool guy. So thinking about what happened, 1 second before. So this is just a little cartoon. It's supposed to be an amygdala. So the amygdala is like the center of the emotional center of the brain, the limbic system. So you could say, catecholamines, like norepinephrine, right? That was a chemical that was involved in that aggressive response. There was a fear response. The amygdala detected a stressor or a threat. And then right before the aggressive response, maybe we had dopamine, right? Dopamine actually created this motor pattern of aggression. So that's one thing. That's why aggression happens. But another why aggression happens is the environment the dog is in. Us veterinarians, particularly veterinary behaviorists, we are very aware that going to the vet clinic is a very stressful thing for almost all patients. So, the fear comes from the environment. This isn't the dog. This is the dog in this environment. Clearly lots of stress signals there. What about ours today? What about that hormonal milieu that the dog is in? Could that be a reason the dog is showing aggression? Poor sex hormones, they get blamed for a lot, right? But of course they are kind of important. They are setting the stage. We think a lot about the stress hormones like glucocorticoids, for example, norepinephrine, the neuropeptides. Again, we got I think your latest papers, right, on your CV are about things like vasopressin. That's a why dogs might become aggressive or an animal might become aggressive as well. But the point is those are maybe more slow acting, more setting the stage as opposed to an acute response to fear. This might be think of it more of a threshold level, perhaps, a lot of these. It's probably an oversimplification. You can school me later. Weeks to decades. So neuroplasticity, that's just kind of nerd speak for every time we encounter anything in the world, our brain is changing, right? And that can happen immediately. Like my neurons, and particularly my hippocampus, are changing right now. Seeing you guys, seeing this beautiful campus. Your weather could have been a little bit better. But nonetheless, is that little peaks of sun? No, that's artificial light. So this example, a dog is showing aggression. Can I train this dog using one of our favorite techniques, marker training, reward-based training? That is any age dog right in front of me. We can actually use learning theory, operant and classical conditioning to change the brain structure on some level. But I rely on my developmental psychologist, again, right here, to tell me a lot more about the brain. When is it most open, right? Like neurologically, when are they most open? When is the most neuroplasticity setting in and happening. When are the most, the biggest changes happening? So of course I picked this kitten here, interacting with the world, dogs from that 4 to 14 weeks or 16 weeks, depending on who you read. That's when their brain is most open to understanding things in the world around them and therefore not having as much of a fear response. That's a total oversimplification, of course, but cats, we think it's about under the age of 8 weeks. So those are really like the same learning may not have exactly the same impact depending on what age the animal is. But of course, old dogs can learn new tricks. I do it every day. So veterinarians, and maybe you guys too, I use any excuse to put my own dogs in talks. So this is, these are both Irish setters. Yes, people still own Irish setters and I'm one of them. These are my pandemic dogs though, I have to say. So what about genetics? I apologize, that was on the wrong. Let me go back to that. Yeah, so genetics, I do have it on the right screen. These dogs are, dog breeds, purebred dogs are sort of like island populations, right? They have very little genetic diversity within a breed. Irish setters are kind of cheetahs that they have very little diversity even for within a dog breed. They're always bottlenecks within these breeds. But I picked this video. We're gonna play again. We're gonna play with the cute one. So clearly their ages are very different. But I picked this because their coats are very different. Their personalities are very different. So this was a slide just to illustrate how individual differences can play a big role, even though genetic background is probably very similar in these breeds. Behavior is a phenotypic trait that is subject to evolutionary pressure. So I bet everybody in this room knows about the Siberian fox experiment. So that's the wild type of the silver fox. And then this is only choosing behavior over many generations. Was it 30, something like that? I should know that off the top of my head, but I don't. So only selecting for friendly or unfriendly behavior. This is what we got. So these color genes, fluffy tail, things like that came along for the ride with behavior. So what does this tell us? Why do we care about this? Other than it's really cute and you can buy one of these for like $10,000. This is probably at least part of the story of domestication, the genetic changes. So this is, we think we found, I don't know, I said we, I have nothing to do with this. Really smart people that I have known and talked to think this is at least part of the gene profile for tameness and probably what was happening with dogs, cats, maybe to some extent, some of our other, hooved stock that are domesticated as well. This was just a really exciting time, probably back in 2010 or so. So genetics on an individual level, genetics on a breed level, genetics on a species level. And of course, I pulled this from Dr. McLean's lab page because again, it's not, we can't look at that we can't look at genetics in isolation. What domestication did is give these animals the possibility, right, to be social with people, especially cats. And I picked this picture because that's my good friend and colleague, Margaret Gruen, who is a veterinary behaviorist extraordinaire at NC State, which is the connection I have with these guys. They worked together at Duke before coming here, and Margaret getting her full professorship, I guess, at NC State. But what they're doing is learning more about, social referencing. And that's just really very cool. And she played, by the way, in this big conference we were just at, the video of the puppy, like I think 12 weeks, that was first doing, like he couldn't figure out the task and like first looked at the handler and looked at that and was like, hey dude, open it up, please. So my understanding from that, it was we caught that on video for the first time. So that was really very cute. So very cool. It may seem like a no-brainer because we all own dogs. And so you take that for granted, but that is a very, the ability for domestic animals to use social referencing is just really very cool as well. So that's more of an evolutionary time scale that we're talking about here, decades, millennia, centuries. So put all those together, again, that's kind of, all of that is informing how I diagnose behavior problems, how I educate my clients. You know, in treatment, I can't change genetics. So I'm not necessarily, as a veterinary behaviorist, working with an individual family. You know, I'm probably working on these more proximate. So if we're talking about evolutionary terms, these might be proximate factors. These might be ultimate. In a medical framework, these are acute factors. I don't know if we necessarily call these chronic. They're not a problem. But we're probably, you know, we're working here. The neurobiology, the environment, the endocrine milieu, or kind of baseline neuroplasticity right here and there. Like I can't go back and change their socialization. It kind of makes us cringe when people are like, oh, I'm going to take them to the dog park to socialize it. I'm like, oh, no, you're not. You're going to take them to the dog park to flood him and scare the, you know what, out of him. So, but these are important factors. And that's why we need to be collaborating and learning from each other. So let's look at some cases and maybe like some problems and how I would go about thinking about those. So this is a cat that clearly is very proud of himself for peeing outside the litter box. Just kidding, right? So let's talk about feline house soiling and how do all those factors play into a treatment plan. So remember, behavior is a symptom to us. The behavior peeing outside the box is the symptom that I need to change into peeing back into the litter box to keep this cat in the house. So somatic disease. So that's just sort of a fancy word for not directly a stress-related type behavior or emotional change. Environmental needs. What are the environmental needs of the species that I'm working with? What are the social communication capabilities and needs for this species, for cats? So starting with somatic disease, what we are going to be doing a physical exam. We're going to be doing what we call our minimum database. So we're going to get some blood work. We're going to get some urine. We're actually going to look at these things under a microscope or analyze them with a machine or put our hands on it and feel for something that doesn't seem quite right. So what are we kind of looking for? Of course, the cat peeing outside the litter box, we're looking at, is there a bacterial infection, for example? Is there sterile inflammation? Let's say from, say, crystals, which could go with those, but beyond the talk of this, neoplasia, you know, is there something I can put my hands on and kind of diagnose there? Endocrine diseases. So that's sort of in that, according to Sapolsky, sort of that hours to weeks, right? Like, so do we have an endocrine disease that's like diabetes, hyperthyroidism, that are doing things like changing the amount of water that animal's brain is telling it needs? So it's drinking more water. Something is triggering that we need more water, and therefore we've got more urine output than the litter box can kind of handle, or it can't make it to the litter box all the time. Hyperthyroidism in general can kind of increase metabolism and change all sorts of behaviors, create agitation. And then pain, maybe not outside of the urinary tract, particularly orthopedic pain. We'll see that. It actually hurts my hips, you know, to go to the litter box. So that's kind of one of the first things we're doing. But beyond that, our job is not done. And this is what we're trying to teach, you know, our vet students. Like, don't be like, I don't know what else now. What else does that cat need? What about its natural history can inform our treatment plan? So you know, a lot of people in this room probably know you can't just go to the store and assume that things that are available commercially are actually going to be good for the cat. So, you know, chunky, self-cleaning litter boxes have nothing to do with what the cat actually prefers based on evolutionary history. So the African wild cat is it's still living relative, and it lives, this is the type of soil that cat is going to urinate and defecate in. So our domestic house cats are remarkably similar in morphology and behavior. So the further away we get from this, the bigger the problems we're going to have. So that's part of my treatment plan too, right? And also, you know, cats are not going to pee and poop in the same spot. So if you have a small litter box that is never clean, that's going to be unnatural to them. They don't pee in caves. So, small covered litter boxes are probably going to be a deterrent as well. What about their social? So I'm assuming, there's different reasons that cats might eliminate outside the box. Some of them you can kind of clump into what we call like litter box aversion. There's a completely different use for the urine in a cat world and a dog world, and that's social communication. So are we meeting the cat's social needs? Are we putting that cat, cats are, again, the only domestic species that evolved from a solitary ancestor. That's really cool. But it does mean that we can have very difficult social connections, and social groupings can be difficult. And they, once they're kind of like know their social grouping that's stable, you can have some friendly, or at least what I will call polite roommate behavior. You don't have to be friends to be able to live in the same space, but they are going to be extremely agitated about outsiders. So is that something that's going on? We've got urination has nothing to do with the litter box, but it actually has to do more with, a territorial or stress displacement behavior. I just put these two up too, because, if you do not have a highly complex social repertoire, communication repertoire to begin with, because of interspecies communication, and you have to develop one to be able to live close to each other, this tail is a pretty good one, right? So I just wanted to juxtapose this frightened cat, stressed cat with this, what's a good way to tell from a way off whether that cat wants to interact or not? That tail flagged is almost a friendly, I would like to interaction there. What else does a cat need? Remember, cats are not just predator species, but they're mesopredators. They're in the middle of the evolutionary, or the predator hierarchy there. So they are both they're going to show behaviors and inclinations, I would say even more prey than predator. So what does that mean in our home? We need to make sure, if you want a happy, healthy cat, you need to make sure they have a feeling of safety, not just from predators, AKA us, our dogs. We've been starting some, just starting to look at how cats and dogs kind of live together, particularly from the cat's vantage point. We like our friendly, setters and silly dogs, but is the cats, okay with that? And what impact is that having on them? And so any unwanted social interaction, both within and between species. And of course, what we got to talk about, yes, I understand your last cat was, basically like a dog in a cat's clothing, skin, but this cat, genetics, early life experiences, this cat's going to have a different, perhaps susceptibility to stressors, might not be quite as resilient when it is exposed to stressors. It might not bounce back from it as well. So this is, hiding spaces are a big one for cats, that we want to make sure that they always have an option to hide, whether it be in our homes or in the vet clinic. What about feline cognition? Where does this come into play? It's usually communicating with a client those feline cognitive capabilities. So I totally get it that if your cat seeks out your shoe and pees in it, why would you not think that that cat is mad at you and being spiteful, right? Of course you might. But so it's our job to explain they really don't have that cognitive ability. Your cat is actually really stressed out. There's probably something, I don't know if that's really been worked out. I certainly am not going to tell you I know the answer why they're peeing in your shoe. But it's obviously got something to do with the smell. Your shoe is probably quite smelly. So there's something to do with that. But, bringing it down to their level is actually really important for animal welfare. When we start giving them more cognitive capabilities, and Dr. McQueen, I loved all your examples last night. If you guys have not seen that talk, please go see it on YouTube. It was wonderful. And also associative learning. So we have all the time, let's say there's an infection and it was painful to go to the litter box. We cleared up the infection. We appropriately treated the pain, but you can't forget neuroplasticity and learning. That litter box created pain. They don't have our ability to say, oh, I took my Aleve and my antibiotics and I can go on that run today. It's not going to hurt. They just know that litter box hurt. So oftentimes we have to do a little bit more. That's one of the things that we have to keep in mind if we've got a problem that seems to be resistant to treatment. So other things we're thinking about, of course, addressing all those other diseases, like if they're hyperthyroid. I'm never going to fix this if I don't fix their thyroid. But this problem, cat problems in general, I'll be so bold as to say most of those are poor environmental needs, even more so than our dog behavior problems. People just don't, we try to like cram cats into a dog world. So cats have very different needs, and hopefully, we're doing a better job at educating the world. And then, the neuro up there in that 1 second to 10 second, those acute stressors. Is there something else that I've got? So particularly like if we've got a stress urination, a stress communication, those are probably going to need a little bit more help in addition to changing the environment. So I'm not going to talk about meds very much, but we've got lots of neurotransmitters that we can help with, supplements, prescription medications, but all of those are kind of working on the limbic system, other than if you diagnose the pain. A lot of cats' pain goes unrecognized. So let's get into talking about client communication a little bit, because like a pediatrician, my patient is not my client. So the cat and I we're seeing eye to eye, man. We're on the same page. We've got this, I don't know which one I am. I want to be this guy. So we've got to make sure the pet parent is on board as well. And that's a problem. So I can educate all day long, but we've got to meet them where they're at. Like I can tell you, your cat is not going to like that plastic bead litter, but I'm going to get nowhere if I ignore the fact or judge them that they say, my kids have asthma. I cannot have a dusty litter box in my house. I've got to have that collaborative conversation. And you can apply that to everything we do. Like I may know the answer and know what they need, but if I don't get buy-in from them, what's the point? And recognizing that because pets are basically part of the family now, and I would say, I'm getting kind of up there. My pets have always been part of my family. This is not some new phenomenon with millennials. I just think they spend more money on their pets, and that's why the marketing teams are taking notice. But this is very stressful for them, and that's why veterinary social work is, and that animal bond, the human end of the leash, or the harness, whatever, is so important to also pay attention to. It is, it's medicine. It's medicine for them as well, to make sure that they have support. So I'm vetting, University of Arizona does. University of Tennessee has one of the first veterinary social work programs. And so, we've had pet loss support, things like that forever. But pet loss support's important, but we want to also help them before we get there, right? I've had marriage counseling. I'm not kidding you. In the middle of if you want to keep the dog and you do not, this is a problem. Like before we start working on these detailed plans, we need to go talk to social workers and we need to get on the same page. Whatever it is, I'm not here to judge, whatever it is, but we're not going to get anywhere without this. So I do also want to mention the neat research that's been going on in burden of care research in veterinary medicine. So what in the world is burden of care? I mean, it's what it sounds like. So the quality of life, it's studying the quality of life of caretakers for patient, their family member or somebody in their life that has a chronic disease. So it's trying to put metrics on some of these more subjective emotional states, but also objective measures like how much time, the financial effects that being a caretaker of somebody with chronic diseases have. Like I said, we've been looking at that more. I've got a colleague in Chicago who's been working with, her name is Dr. Spitznagel at Kent State, has been doing a lot of research in this really cool stuff. So no surprise, I'm sure, it's common sense that the severity of the disease, the burden of care goes up with not only the severity of the disease, but the complexity of the treatment. So it might actually be, not a life-threatening disease, but if it's a really intricate treatment plan that takes a lot of care, then that's going to be a problem. we would need to help those folks out a little bit more. So here's some of the fascinating research. So in veterinary medicine literature, burden of care, behavior problems have a higher burden of care score than even things like cancer in their pets and dermatitis. I don't know, does anybody have a dog that suffers from atopy or itchy skin? I have one of my first ones now. It's a big burden of care. Like that's a lot of money on their anti-itch medication. It is really frustrating, and yeah, I feel helpless. I can't help this dog when his medications are not working well and he's got excoriations and skin disease, right? So don't just blow that off. And I also lose a lot of sleep from listening to him itch. So that all goes into this, right? It's not a fatal disease, but it's actually got a decently high burden of care. Does that make sense? So kind of changing gears here. Again, one more case. How am I doing on time? Okay. Time for me right now is a kind of a moving target. So let's go back to like an aggressive dog case and maybe look at things even more, open up our discussion even more. So let's look at what if this dog that's showing aggression is 2 or 3 year old intact male German Shepherd. And the family got the dog from a breeder who did a lot of bite work. Have you, about that sport and protection work? So, think about that when we're talking about genetics. So the problem that they're being presented for is growling, barking, and lunging. I think we can get the idea here. When the dog is approached, in particular by an unfamiliar person, particularly if they're near the dog is near their person, their preferred person. So how would I go about thinking starting to dig into this case? Now, I didn't have a video of this one, but I do have one from Dr. Yin, allows me to use her videos. So verbal history, again, getting back to that human filter. I am not watching this. I am not triggering it. That might be a difference between some dog trainers and us, is I don't need to see a dog vomit to diagnose why it might be vomiting. And I don't need to see a dog actually show aggression to be able to diagnose what's going on. I do, however, need to get an efficient and accurate description from the people that were there. So if you got video, great. So let's look at this dog. So what do you think, how would we go about starting to diagnose what's going on there? What are we looking at? Right, so hang on there. I'm going to talk about that in a second. But what he looks like, right? We don't have sound here. I don't think this dog is making any sounds anyway. But you don't need to have a PhD in canine behavior to know that dog is uncomfortable, right? But we want to teach our vet students and our, students of any kind to break it down. So we want to look at the eyes. Breaking down the body language. What do the eyes look like? What do the ears look like? What does the tail look like? Are they making a vocalization? That can be very indicative of what's going on in their inner state. But also, what was the environment around the dog? This didn't happen in a vacuum. It's something about this environment and the stimuli around the dog contributing to this. So it's as if I paid you, or I'll give you your $20 after. We love the ABA, the Applied Behavioral Analysis, or I do anyway. I shouldn't speak for all my colleagues, but this is just such a useful, simple tool to think about, right? So the antecedents is what we were going for there. The A, the B's, and the C's. The antecedent, the behavior itself. So to us, that's the problem. And then these are the risk factors, you could say, in a medical framework. And then consequences, right? And then the consequences. So if the aggression was successful, how does that feed back into the antecedent the next time? So if we're thinking about that aggressive dog, or, we could look at this guy. I jumped ahead there a little bit. So, what do you think this dog's eyes probably look like?
Alive.
Could be whale eye, but, definitely round, right? Not everything about this dog is probably tight. So that's going to make its eyes look big. Its pupils are probably dilated. What about the ears? Down and back, right? These are objective Like, it doesn't matter if you and I agree on the emotional state right now. We can at least be talking about the objective body language. So that's my data, my minimum database. The spine, right? This dog is crouched. It's hard to see right here. He's got a little nubbin, but it is tucked. And he was moving away, right? Like, what is the whole body doing? There's not a standing still. There's not an approaching in a friendly manner. He's moving away. So again, what about, let's go backwards now and look at the antecedents. So this is just another framework for kind of the same stuff we were talking about, right? It could be the Sapolsky model. Those were all antecedents. They could be acute antecedents or proximal antecedents, and they could be distant antecedents. They could be acute acute risk factors, or they could be chronic, things that have been going on chronically. All different words for kind of the same thing here. So what I would actually do for this dog is I would talk to them about, one of the antecedents was what the human was doing there, right? Like, what was that human doing to that dog in that video? Do you remember? Leaning over, right? If we lived in a land of giants and somebody did this to you, what would you probably, whoa, what you doing there, bud? So that alone can be threatening. That is can be learned, it can be shaped by learning. Particularly early socialization, right? A lot of these dogs not only genetically are pretty friendly, but we did a lot of work with them during that prime socialization phase that yes, we are giants, but we come with good things. So the physical space layout, maybe we're not approaching this dog, right? We use consent to pet or assent, I guess is the new catchword, giving them choice instead of me going up to them to pet them. So this dog, that's going to be really important. And then the preferred human. I guess everybody, I think I'm preaching to the choir in this room, but if I hear the word protective one more time, and some of my colleagues do actually use that, but I don't think it means what people think it means. Like, I don't think the dog is putting on its Superman cape saying, do not hurt my person. I think it's more mob mentality, right? That, oh, I've got my person is here to back me up. So essentially they're hoping you'll protect them in a lot of these cases. So even though the dog is choosing fight over flight, it is still, those are the symptoms, the emotional state is still the same. So again, these are all, the antecedents. Moving a little bit further down in our timeline or back, if we're looking at the Sapolsky model. So pain, that could be a threshold modulator, right? In the moment, like if you actually hurt the animal, like if somebody actually came up and punched me, I'm probably going to be giving you some words back in that moment. But also if I'm in chronic pain, it's going to change my threshold level. So other things like, is the dog hangry? Do we, were there UPS man there 10 minutes ago? Or do we still have those glucocorticoids and that norepinephrine and catecholamines floating around? Previous learning. So going to the aggressive dog, that probably was very effective behavior to create distance between the dog and the thing that frightened it. Or threatened it, I should say, is probably a better word. Developmental exposure, I was kind of jumping ahead there. Has this dog actually been exposed in a positive way to unfamiliar people? Or we did not have enough of that, so we kind of fall back, probably set by genetics. We're talking about, I don't mean to breed pick on the German Shepherd there, but we can't get away from the fact that a lot of those dogs have been, their behavior of using fight instead of flight was a selected trait, just like anything else. So if you combine that with not enough positive exposure, the dog is likely to choose that behavioral response more often. And then genetics, natural history. Just wanted to be complete with my list of antecedents here, although not doing anything about the fact it's a dog, but I can do something about these, right? So what am I going to do about it? I already kind of jumped ahead here. Antecedent arrangement, and that's what in behavior world, or our behavior world, we probably call environmental management. So avoiding those threatening interactions. Again, having that conversation with folks is still very important. Making sure that whatever plan I come up with, it is with buy-in and input from that home. I haven't met many people that aren't willing to do consent to pet, once they kind of understand that concept of behavioral choice, that, oh, you need to have the dog to come to you instead of having the kiddos, jump on the dog. But there occasionally pops up a reason, maybe it is a quote unquote emotional support dog. So the dog is on a leash a lot. There are going to be people approaching it. That is a conversation that we have. What else? Again, I kind of like breeze through associative learning and training because we in our framework, in the veterinary behavior framework, we kind of consider our behavior modifiers and our trainers of the world, they're sort of our nurses. So we're usually pushing that over or down a scale. I shouldn't say that because they're very important partners. I don't want to in any way insinuate that that's below us. But it is something that a whole lot of people are very good at, and you don't have to have a doctor, veterinary degree for that. So that's usually from an economic standpoint, we usually partner with people or employ people that actually do the behavior modification once we've done the diagnosing and the medication part of it. So speaking of which, is there something going on with this dog that does he have a general fear? Do we have a general anxiety disorder? And this is just an acute response that's layered on top of how stressed out this dog is. And therefore that kind of informs our medication choices, right? Are we using things that work quickly within a couple of hours and they're gone in a couple of hours? Are we thinking about things that are in the human antidepressant class? On this side of the pond, we don't really diagnose depression so much. But that said, they can be really effective, mild to moderate effect anti-anxiety, and they affect serotonin for the most part, but also norepinephrine and dopamine. But the thing we're recognizing a lot of is the role of pain in behavior, both chronic and acute pain. And I've already kind of talked about that a little bit. So medication supplements, meeting them where they're at. If this is an anti-medication family, and I do think medications would be helpful, we often do start off with these quote unquote natural supplements. And then I kind of purposely said that this dog was intact. What would you do? So probably, I'm asking you guys, I have no idea what your background is, if you actually work with folks or not, but what do you think, any thoughts about neutering this dog? Is it going to help? Is it going to do nothing, or is it going to make it worse? What would your thoughts be? Raise your hand if you think it's going to help. It's okay. I mean,
It might.
it might. I think that's a fair question, a fair comment. Who thinks it might not do anything? But the data kind of lean towards, there are lots of reasons to neuter a dog, male dogs in particular. Once their growth plates have developed, we reduce the risk of orthopedic issues that might come from early spay and neuter. And I can talk to you about that later if you're interested. But behaviorally, it's a bit of an old wives' tale that is going to help human-directed kind of fear-based behavior. It will help if you've got two intact male dogs fighting. It will help that. And then the whole spaying is a whole nother one. I actually own that little Irish setter that you saw. I left her ovaries in. So she has a hysterectomy, but I used her as a guinea pig just to see. All my dogs have been neutered, right? I live in America. This is just the thing we do for many good reasons. But are there certain dog owners, pet parents that maybe we can look at that with a little bit more of a nuanced eye? So I started seeing issues in her very early. So I decided, hey, if anybody can handle, the side effects that might come with it, it's probably me. So yeah, so just so you know, neutering and spaying is not really a treatment for most types of aggression. But there are lots of other reasons to think about it, because she does, the things you think about with an intact female, I do get some discharge, and it's not for everybody, that's for sure.